This is the typical rib. It has a head, it has a neck, it has a shaft. The head of the typical rib has two facets, one for the vertebra of the same number and the other for the vertebra above. And this is the neck. The shaft has an upper rounded border for the insertion of the intercostal muscles and a sharp lower border for the origin of the external intercostal muscle. And above it, there is the groove, the costal groove, for lodgement of the intercostal vein, artery, and nerve. At the level of the neck, here is the tubercle of the typical rib. It is related to the transversal process, related to a facet in the transversal process of the vertebra of the same number, forming the costotransverse joint. So this is by far the commonest feature of this. This is the costal end, which articulates with the costal cartilage as the costochondral junction. If we look to typical thoracic vertebrae, I'll find this is the body, heart shape, and this is the transversal process. The transversal process has a facet here. If I mark this facet, it is related to costotransverse joint, or it is related to the tubercle of the rib of the same number. And this is the head, this is the body. It has a demifacet above and demifacet below to articulate with the head. This upper demifacet, it articulates with the head of the same number. But here, the lower facet is articulates with the head of the number below it. If this is the third thoracic, so it will articulate with the second rib. This lower demifacet or inferior demifacet, but the superior demifacet articulate with the head of the vertebra of the same number. And this is the spine, characteristic of this spine downwards and backwards. And this is articulation for the vertebra above, and this facets for articulation of the vertebra below. And this is the vertebral frame, and this is the vertebral canal, and this is the body of the vertebra, which is related to the intervertebral disc between the two vertebrae. So this is the main features of this one, the body. If I mark this area, so this is the body of the thoracic vertebra. If I say name structure related to this intervertebral disc, if I mark this is superior hemifacet, structure related it the head of the vertebra of the same number. And this is the inferior demifacet, is related to the head of the rib below, but here is related to the head of the rib of the same number. This is the transversal process, and this is an articular facet in the transversal process for the tubercle of the rib of the same number. If I mark it and structure related to it, so it is the costotransverse joint or the tubercle of the rib of the same number. If I look also to the first rib, the first rib has an upper surface and lower surface. It has an inner border and an outer border. It has a head which contains one facet to articulate with the first vertebra, and this is the neck, and this is the tubercle to articulate with the transversal process of the first thoracic vertebra. This is the inner border of the first rib, and this is the scalene tubercle. In front of this scalene tubercle, I'll find groove for the subclavian artery, and behind it there's a groove for the subclavian. In front of it there is a subclavian vein. In front of this is a subclavian vein, related to subclavian vein, but posterior to it the subclavian artery and the lower trunk of the brachial plexus, because this is anterior and this is the posterior, and this is the scalene tubercle. The groove anterior to it is related to the subclavian vein, and posterior to it subclavian artery and lower trunk of the brachial plexus. If I found here for, so this stop